Good evening, everyone. Good evening. Good evening. Surprise Live. How are you doing? Good evening, everyone. Good evening. Good evening. Good evening. Welcome to the evening live. Welcome, one and all. As you can see, the topic: how equipped are our hospitals here in Jamaica? Time is very hot. Just came in Just came in from work, guys. I'm a bit sweaty, but I have to say my piece on hold on this. Welcome, everyone. Welcome. Surprise live, guys. Pop up live. Welcome, everybody. Like, share, and subscribe. Good evening. Good evening. Good evening. How equipped? How equipped are our hospitals here in Jamaica? Are our hospitals equipped to care for the poor and needy? So I was at work today. And they in the district association group, I see where they sent out a video where um, a lady went to the Falmouth hospital for treatment. She got a stroke, and her daughter took her to the hospital at about 5 a.m. in the morning. Now, Falmouth Hospital, as I said, this hospital is in Jamaica. It's a public hospital, guys. They provide um, general medical services in the community. So there's a lot of adjoining communities here in where that one hospital um, in this region has to attend to. It offers various health care services such as emergency care, outpatient care, inpatient service, serving the residents of Falmouth and the surrounding butts. Hi, sister. Good morning. Good morning. How are you? What's here? Have mercy. Good evening. What is wrong with me? Normally I do lives in the morning. Like me, I say good. Good evening, my sister. Good evening. Good evening. Yes. So that one hospital provides health services for many persons, many persons. So they sent out the videos in the teachers group. There was this lady, she took her mother to the hospital. Her mother got a stroke, and she took her mother to the hospital 5 a.m. In the morning. When she went to the hospital, there was only one doctor on call, and the doctor said that he was the only doctor, and they couldn't attend to her. She had to wait. However, there were other patients there also, so the doctor had to be, doing what he can. But what I'm saying, for The Falmouth is a type C hospital. It's a type C. Cornwall Regional send up patients to Cornwall Regional sometime because there are some surgery that cannot be done in at Cornwall Regional Hospital, so they refer them to Falmouth. However, there are some things that are lacking. Thumbs up the live for me, please, as you come in. There are some things that are lacking at the hospitals in general, especially public hospitals here in Jamaica. One such thing is CT scan. Now, a CT scan is very vital to every hospital. So I think that I strongly feel that all hospitals should invest, or the government should invest in CT scan machine to save lives. Because when a person get a stroke, you need to do a CT scan to see the damage that the strokes did to the person, where either the brain or wherever. You have to do a CT scan, and these hospitals are not equipped. They're using secondary facilities to provide that services. Now those services, secondary services, you see, from them open 8 o'clock and close by 7 o'clock. If you are dead, you have to go dead, because guess what? You have to wait until they are open. So this is the case with this lady. She said we should spread the word because she took her mother. The mother was in pain. The lady a ball in pain, and they did not give her anything to ease the pain. You know, but I just strongly think that the government should pay more attention to health services, healthcare services. Thanks for thumbsing up the live here in Jamaica. Because why this touched me, you know, because I'm living in Falmouth, and if anything, I have comorbidities. So if anything happened to me, I have to rush to Falmouth Hospital. Me not have the money like one time when me run go as Mobile Hope and they nearly kill me off down there. Me not have that type of money again. I Miss Gail, good evening. Welcome. I would have to rush to Falmouth Hospital, and many persons since of late. If your head hurt you and you go in a hospital and they admit you, if you come out back, you have to give God thanks. Many times they don't come back out because guess what? They are not getting the correct the right treatment, and they are not being attended to. Thanks for tons properly, because guess what? They don't have the correct equipment. All right. So Falmouth don't have any CT scan. Why did they transfer this lady to Cornwall Regional? Now Cornwall Regional CT scan machine probably was not working because the doctor in emergency told the lady in question that she would have to wait until 8 o'clock the morning to go to G West. Now when 8 o'clock come, it's a long line, because I recently did a CT scan at G West. And emergency or no emergency, who come first? You see, once you register in the lobby, and you change your clothes and you go on at the corner, you see how much stretcher line up. You understand? A first come, first serve. So if you are dead, you just went there. That's how the system set up. And that is not right. I think the system just look at a life as nothing. Then just look at as a life as that's a fact in regards to health system. Yes, Miss Blake. They need to put more emphasis, put more money, get sponsorship. You understand? For the hospital. We have a whole heap of friends of Jamaica. Make sure that every hospital have a CT scan machine to save lives, because lives are important. Sometimes you go to the hospital if you want simple little something and you spend actually the entire day because the system is flawed. The system is flawed. You understand? But yet, the government find money to be paying for buildings, empty buildings. I don't know if guys, if you follow current affairs, you know, I follow current affairs, the things that are happening um, here in Jamaica that will impact us, you know, that will affect us if we sick. You understand? So instead of the government paying, recent update, the government, there are 2 or 3 empty buildings that the government have paying millions, billions of dollars for empty buildings. You understand? That money could be pumped into the health system. Buy one little CT scan machine, or buy one of Cornwall Regional, because Cornwall Regional is central. So if somebody from Falmouth area um need to do a CT scan in the middle of the night, in the wee hours of the morning, at least they can rush them to Cornwall Regional. Get one for Falmouth too. So if Cornwall Regional broke down, vice versa. You understand? I don't like how the our health system is. I don't like it. It's like patient lives does not matter, and you have to be in a certain class. You understand, to get through when you go to hospitals. When is it going to change? When is this going to change, guys? Millions of dollars are they waste. You understand? Paying persons. You have persons who are on fraud charges here in Jamaica. You understand? Fraud charges, and they still get half of them pay. Plus the persons where the persons who they employ to work for them. Them something they must cut out, and those money should be pumped into the health system so that every Jamaican can be comfortable and say, oh God, the good on at Falmouth Hospital, you know, army go. I'm glad you bring this up because it's set away. Yes, Miss Blake. You understand? So Jamaican can be happy and say, oh my God, I like how the government put in place. You understand? Things so that we can get better when we go to hospital. When you go to hospital, you know, I tell you the truth, you know, you just have to pray and say, God, make me come back out. God, so in the case of this lady, you understand, the lady paid the $25,000 to do the CT scan, right? To do the CT scan, she paid for it. The sister go to Montego Bay and she paid the CT, the money. When the time come, I'm going to play the make you guys hear the daughter crying and pleading. You understand? It could happen to any one of us. You understand? I remember several years ago, my mom suffered a stroke, and she lived all the way in St. Anne. My sinuses, but she lived all the way in St. Anne, and St. Anne's Bay Hospital at that time did not have a CT scan machine. We have to travel all the way from St. Anne to Montego Bay to do the CT scan so that she could get the correct treatment. I don't know if it has changed now. I don't know if St. Anne's Bay Hospital has CT scan, But me know say Falmouth not have none. Because when me go do my something, they me say whole heap of patient, so them have some partnership. But we need to do better, and I hope the government is listening to this lady cry. It cannot be that we have a health system where treat us like dog. You just go in there and a one doctor. What happened? We short on doctors, people. Is Jamaica short on medical doctors? So if that is the case, that doctors are scarce, why not send out advertisement to other countries, employ doctors from other countries, from Cuba, from other Caribbean countries, to come and work in our health system? Because there's no way one doctor can manage emergency. You never going to want emergency in a room yet and see how much people did there. Gunshot wound, broken hand, crash, people with strokes, all sort of something. One night I took my neighbor down there because some allergic reaction. And may I tell you the truth, we go down a hospital like from 7 o'clock. I true me the talk, people, facts, 7 o'clock. 7 o'clock in the night, and we never get through until about 1 o'clock. So we had to be on the road about 1 o'clock. No, man, the system of it, I don't know if in other countries, if it is the same. You understand? I don't know, but really and truly, Jamaica health system is very slack. You understand? Jamaica health system is very slack. Even one of in the video, the lady said that. All right, when the time come, when she see 8 o'clock come, and they ask the doctor if the ambulance can carry her mother now to get the CT scan done. The doctor said there are 2 ambulances, but they are not available. The lady said that she asked if she could hire a private ambulance. The doctor turned to her and said, even if you get a private ambulance, none of the nurses would want to travel on it. And me just said that is so unkind. I don't know if it is some policy or whatever. So may I tell you now, guys, life, no matter, when you go to hospital, is just another 6 patient. Then just throw you down like a piece of meat, and and then not move with no urgency or anything. The lady said when 12 o'clock comes, she asks the doctor what is happening. Nobody still. She buy medication for $95,000 and give them for the mother. The hospital lost the medication. May I tell you see all this something there? How can you lose a patient medication? Guys, me I go top chat and make gonna listen to the lady. She said we are to spread it, and because I am living in Falmouth. You understand? I am living in Falmouth. Me pass Falmouth Hospital every day when me I go work. So I'm going to allow you guys to listen to the lady. It was, as I said, it was placed in our teachers group, and she asks persons to shed some light on it so persons can know what is happening. It's 2 parts. You have part 1 and part 2. So I'm going to play it and let you listen to it. Hold on. Let me take off my headset. Hold on. Like up the live, guys. All right, so I'm going to play so you can hear.
This morning I woke up and I feel so hurt. I know you because the hospital no have no CT scan. They no have no ambulance mover.
Hold
And you have
on. So this is part one. Hold on.
hurt. You know, my mother died. I lost my mother yesterday. And I know that.
Hold on. This is not it. Hold
But
on.
tell me, say, nothing at all. We can't, nothing. We can't provide nothing. But I remember that they cry. Pass the pressure pill. Pass the pressure pill. Me head. She saw 5:30 now, you know. We come off the ward. They say must wait till 12 o'clock. So I'm watching my mother suffering with pressure extremely high. Yes? All right. 12 o'clock come. I say, security, can you please go in and tell the doctor it's 12 o'clock? So she needs to go down to radiology West Montego Bay.
Hold on. Hold on there,
Security come back
guys.
and
Hold
tell us,
on.
and
Let
they
me
say,
see where it started. Hold on. Let me see.
you know, this morning I woke up and I feel so hurt. You know, my mother died. I lost my mother yesterday. And I know that we are not to die one day. But when it's the negligence of the hospital system in Jamaica that led to the sudden death of my mother, it hurts. And I think people should know what is going on in the Jamaica medical system. The health system is rubbish, it's garbage. So I ask you to blast this for me, put it over pink wall. I need Christopher Tufton to see this video. I need the Prime Minister to see this video. And people need to see this video. If your family member is sick and end up at the hospital, it's that you can prepare. Plan funeral. Plan funeral. My mother is Gloria Smith Paris from Falmouth, Trelawney. Well known. Beloved woman. Used to operate restaurant. She cooked, give everybody. She got sick.
IJ Brown.
In the wee hours of Friday night.
Evening.
Early morning. She had a stroke. 2 o'clock. She complained that the pressure is high and my father gave her the pressure pill. By 5 o'clock again, she went up herself. Not responding, not talking. So they rushed to the hospital, the Falmouth hospital. I reached at the Falmouth hospital about 5:15. And listen to me well, I'm not making up any stories. She went to the Falmouth hospital 5:15 a.m. Saturday morning. And when I got the call that my mom was ill, I reached at the hospital 5:30. We don't live together. And when we went down there, I said, all right. My neighbor took her down, so I took over from my neighbor and I said, all right, doctor, did she get anything? They said, look like she having a stroke, so she cannot get any medication. They have to do a CT scan. I said, all right, so let's get the CT scan done. Ma'am, there's no CT scan machine at Falmouth. Listen to me. I said, oh, if you have a hospital without a CT scan machine, a big hospital, public hospital in Trelawney, Falmouth. She said, we are in partnership with Radiology West Montego Bay, and so we have to wait until Radiology West is open, 8 o'clock. My mother is in pain, you know. When they check my mother pressure, 235 over 119. She said, my head. She said, my neck back. She said, pain. She said, go for me pressure pill in my brown bag. And they said, we cannot give her anything because she having a stroke. I said, Lord Jesus, my mother is in pain. She said, my head. She said, my head. We said, all right. She went up herself again. We said, somebody can help me change her. We change her off. We said, you have any more robe? They said, no. We said, Lord Jesus. She taking off her clothes. She torment. Pain in her head. She torment. She said, get me pressure pill. I said, mommy. So she in and out of consciousness. I said, mommy, you can't get no pill yet. We have to wait. We wait. We start call radiology West 8 o'clock. Nothing. We said, but what can go? So she's suffering and she can't get nothing. Watching my mother suffer and I say I can't do anything. 8 o'clock I said, Dr. Wilkins. I said, listen, it's 8 o'clock now. The family is ready. They said, we have to pay for it. I said, money ready, let's go. Mom, you have to wait. I said, but Jesus. I said, what do you mean I have to wait? You said the place open 8 o'clock. We're trying to call the place. I said, call the hospital. Mom, I cannot call yet because as you can see, I'm the only one working in emergency. But I said, that's not my business. My mother is suffering. I said, this is an emergency. You tell me to wait. I'm here from 5:30. She crying for her head. She wetting up herself. Oh God, my heart. You think it's easy to watch my mother suffer? Eh? We call radiology West. We can't get them.
Thanks for
my sister that came from Montego Bay to Falmouth had to drive back to Montego Bay to find radiology West at Fairview. We had to get a number. Give the hospital to call. Right? So we get the number. We pay the money. We send them the receipt and say, see the $25,000 a year it's paid. Get my mother going so she can get the CT scan so we can start treating her. She's suffering. People, Jamaica. When we pay the bill and get the receipt, we say, all right, doctor, can we go now? Miss, you have to wait. I say, but what this for me do? What you mean to? I say, yeah, I'm not going to watch my mother suffer and die. When you say we have to pay for it, we pay. Wait, it not finish yet. If the video shaking, my hand is trembling, I'm weak. You understand me? My brother, I come out, my brother going. My brother says, sis, they say, must wait until 12 o'clock. I say, what? And I saw the Indian, my mother said, take off her clothes. So somebody have to be at her bedside. Nothing. She can't get nothing. So she's suffering, from 5:30, 5:15. The attitude, ma'am, you have to wait. I'm the only one in. Oh, if you have one doctor, they run emergency ward at a big type 4 hospital. Anyhow, we say, can we take her to hospital? No, because if she goes to hospital, you're not going to get the CT scan result as quickly as if she do it here. We say, all right. We say, so all right, we pay the money, so where's the ambulance? Ma'am, there's no ambulance available. We say, but what this for me do? We say, so where is the ambulance? Miss, only 2 ambulances working at Falmouth and there. We say, so can we get a private ambulance? Listen to me now,
This is crazy, guys.
Ma'am, if you get a private ambulance, no hospital nurse is going to want to go on it. Mr. What? Why? Because apparently insurance don't cover them if anything happens.
So guys, this happened Saturday. Last Saturday, in Falmouth here. Listen to part 2. Hold on. I'm not going to. Just listen to part 2.
Christopher Tufton, the hospitals in Jamaica short a bed. It's short a bed and people are dying. People are dying even when they can get help. And it is a very sad state for the country to be in. Any country that cannot provide good medical health is going nowhere. It's going nowhere. All right. Result come back by 10:30. We said we need to get her to move now. When I went back to hospital, to farm hospital, we said, all right, how are we going to transport her? Can we get a JDF helicopter? I said, what's the procedure? Ma'am, we are trying to work out her to move, but there is no ambulance again at Falmouth. So we're trying to get an ambulance from Montego Bay.
Very
sloppy. Can we pay for private? Dr. S. Dixon, go and tell me, if you even pay for private, no nurse will want to go. It's about the serious. Before we reach there, sir. Monday night, when we went to look for my mother, remember, so she admit for a Saturday morning. The nurse said, miss, there's only 2 pills left, 2 imodipine left. I said, what you mean? 2 pills left. We bought a week's supply for $95,000.
Nurse them thief the pill.
Miss, there's no pill. Miss, how you mean say there's no pill? Miss, say the pill can't last.
This is crazy.
Miss, I find the pill. Then last, my mother pill, or to me, then thief my mother medication, Miss, said the pill last. Me say on the search, I gave the nurse the pill for 1 week supply. Every 4 hours, 60 milligram. You remember that pill that we pay $95,000 for? Eh? Then say, all right, we're going to search, we're going to investigate who was on duty, but describe the person. Then say, call nurses, supervisor, officer, and report the case that the pill is lost, or in this case, stolen,
Guys,
or thief with.
Can pill lost in a hospital?
When we call nurses, supervisor office at Falmouth Hospital, about 8:30 the night, because after visiting hours, someone tell me say she only have 2 pill, and 2 pill is 1 dose because one of the pill is 30 milligram. So that means if it's every 4 hours, you know, Jamaica, she would miss at least 3 doses over the course of the night. And
negligence
they already
again.
delay her. You understand me? She would miss 3 doses. Me say no, what this I get from bad to worse. Me say no. Me say this too much. This too much for the family now. This too much. Anyhow, because me like follow protocol, me call nurses' quarters and report the situation. Ma'am, you call at a bad time. I say, excuse me?
Really?
Excuse me? That about 8:30 tonight. Me say, I'm telling you that the hospital couldn't provide the pill to treat my mother at first. We bought it for $95,000. Give it to the hospital. The hospital lost the pill. And me, I report it and you tell me, so me call at a bad time in Jamaica.
Boy.
Well, I heard of the matter. We are investigating it, but there's nothing that we can do at this time. I said, what you mean? I said, tell me. I said, Mama, you tell me, say, you know, go provide the pill. At least get the night supply until it's search and find. You go, miss, well, sorry. We can't do nothing about that. You have to come back in the morning. I said, but what is? So, of course, we don't know. Me have to go back to hospital Monday night. And I have the video, and we go release the video.
Yeah, I think so too, Miss Gail. I think Papa Newsling come from Falmouth here.
So, I say, only for last, my mother pill. Them don't know who put you. I say, don't you have a pill tray to put pill for that people get to treat their family members?
95,000.
Miss, we don't know. So what go on tonight? We don't know. They treat people life like garbage at Falmouth Hospital and the whole medical system. You understand me? When she went to Kingston, so look at the ambulance to take her to Kingston. She got to Kingston
it's
Wednesday.
Okay, I thought he was from Falmouth.
At UWI Hospital.
Okay, sorry about
can't
that.
believe. They said, when they admit your mother,
okay.
Mr. Saturday morning, 5:15. We cannot understand. The doctors up there, the team, the neurosurgeon team, can't understand how they have her so long and never ship her off. They can't understand.
Negligence.
When she reached out town, she too late. My mother lungs start collapse, her heart start collapse. My mother dead. My mother dead. Dead. You understand me? Because of the heap of delay and back and forth. And I want this to blast. I want everybody to learn about this. Me not eat. First you go in the hospital, me can't eat. You understand me? My mother dead. Died. Friday after 12. Or if you want to call it Saturday morning. Because when Kingston get her to perform surgery, they couldn't do it. Everything start to fail. I should go in the hospital for Saturday. Tell me now, Jamaica, what kind of health system this in 2024? This must blast. This must be because it could be your family member.
Miss Blake.
It could be a long time. Me go hospital and they shot a bed and me wall it, but this gone too far. All I keep hearing in my head. My mother they cry and say me head, take off it. And that doctor Wilkins at Falmouth go say, Ma'am, you have to wait. See there? You have to wait. She dead. She dead now. And she could have got the help, but because of the neglect. No machine at their Falmouth. You hear me? Wanna blast this swimming. Wanna blast this swimming. Wanna blast this swimming.
May I help you, lady?
This medical system kill off my mother. Kill off my mother. And people need to know. Gloria Smith Paris. I hope you come out of pain now. You suffer. You suffer.
her soul rest in
Her
peace.
pain
Yes.
done now. She dead. Her pain done now. The blast is for me, Jamaica. Blast is for me.
May Miss Paris' soul rest in peace. As Miss Blake said, my condolences to this lady and her family. It's a sad story, guys, but it's reality. Right next door me. Right next door me, guys. And this happened to many other persons, but they don't talk. Because when you go to the hospital, they don't treat your sickness with urgency. You understand? It's like nothing to them. It's like the norm. If they had moved the lady from that time, her life could be spared. Maybe she would have gotten the stroke, but maybe she would have recovered. And the worst thing, they stole the medication. $95,000 is not chicken feed. $95,000, guys, is not chicken feed. Huh? The medication that is supposed to stabilize Miss Paris Smith. It was stolen. It couldn't. Miss Blake, you think say one next patient going to the hospital go teeth out that the medication there, and patient no know what medication is for? It must be a nurse. You can imagine. I don't know what is happening to Jamaica, and I just wish the health system, I just wish the government could, focus. Yes, it's the same staff. It's the same staff, Miss Blake. And it's a shame. It is a shame. Yes, MTC is sad. But may I tell you, mighty God, no, sir. No, sir. When you go, me say, if you're sick, may I tell you the truth. Just pray and ask God to deliver you. Me see one next lady just going to hospital. Her pressure was high. Her pressure was high. And she never come out. She never come out. Because guess what? They did not treat the pressure effectively. And she passed just for high blood pressure. And I know that high blood pressure can lead to strokes. But if you go into the hospital with high blood pressure and you don't have a stroke, the hospital can find medication to bring down the pressure. No, they did not do that. And guess what? Sometimes the hospital don't have the medication. And then they give you a prescription, and then they send you on the road to get fill that prescription. Sometimes you don't have the money. Sometimes some of these persons, they cannot afford to fill the prescription. The hospital provides free medication, yes, but not all. You see, the expensive medication, some of them, they don't provide it. So you find out that many persons go in a hospital and then just gone like that. Sometimes the doctors them try, but a lot of negligence. In this case, I thought it was negligence because the lady was brought in from 5:15, and the children, as you heard, her daughter, she was following step by step. They tried to save the mother's life. Question though, Jackie, why would they steal? Look here, no thief and sell MTC and 95,000 for the medication, So no also them oscillate. Wicked and wicked MTC. As them steal it, and maybe they have a family member who has the same condition like the lady. You understand? And maybe they think so the lady now go live no matter what. So you know what? They probably say, look here, me now waste this medication. But it's not for them to determine. The lady, children them bought the medication, give the woman her medication. You can imagine? This look at this is downright disgrace, guys. Yeah. Blessings again, best um best being. Those of us who live in Jamaica, may I tell you, I don't know what it is like. Jaja, what a world we live in. Yeah. May I tell you the truth? A lot of these things happen all over. Some person not speaking. That's what I'm saying. Many persons, some persons not brave enough to come out and talk. A lot of things happen. But this lady, oh my God. Just imagine what the family, oh, she try. You can't see, say them never they feel for money, guys. They weren't feeling for money. They had the money. Because the lady, Miss Paris, the lady who passed away, she was a business owner. So they weren't feeling for money. You understand? They had the money. You understand? You see? If money could save her, they would save their mother. But Falmouth Hospital, short staff, no CT scan machine, and they were negligence. And then the nurse them allowed the pill to the medication to disappear. Let me put it away there. I saw the lady say, and as she say it, and she said we must blast it. You're loading. I'm loading. It happens in the hospital down here. Time and time, people come out against them but they care zero. A true man, you know. But it's a sad day in Jamaica when I heard it from. You see them anytime you see them post something in the teacher group, you know, it touch deep, and we just hope and pray that our health system, our hospitals will improve. I hope that the persons who are set over us are listening. Oh, it's all right now. Okay, thanks. You understand? I only hope that they are listening to these little cries, and fix it. Because it can be fixed, I see politicians traveling from country to country. You understand? Beg China 2 CT scan machine. Beg China. Just like how you have the Chinese come fix the road and spend this whole heap of money. Roads are important. You understand? Spend this whole heap of money on buildings that are not being used. Paying persons who thief up whole heap of government money. You understand? Invest in the health sector. Make sure that each hospital or hospitals that are in close proximity to certain community have certain equipment so we can save lives, so that persons can live a little longer. You can imagine? Have mercy. Me I beg God for no make nothing happen to me for me go down there. You understand? We just pray and hope and pray that health is important. Of course, it's very important. I'm praying for the family of the late lady that God will cover them and give them added strength that they need. Yes, Miss Blake. They need it. They need it. They need it. In a real life, Jack a real a true man, a true NPC, may I tell you the truth. We just hope and pray. But we want change. We want changes. And this is what we want the politician to zoom in on. The health system caused many diaspora not to return. Hey, best being, you hit the nail on the head. You hit the nail on the head. True. Many persons who would want to return to Jamaica, but they know how the health system stayed. That is one of the sore point, the health system. You understand? That is so true. Hi Trina, hi, blessings, welcome. That is so true, guys. Thanks for thumbsing up the live. We just open pray instead. What I realize? The politicians, the persons who sit in parliament, they focus on petty stuff. Petty stuff like foolish dual citizenship where cannot help the country. You understand? Thank you, Trina. Dual citizenship cannot help the country, guys. What they need to do is to lobby, put on campaign. You understand? We have countries. We have, as we said, Japan. We have Canada. You understand? Many countries where Jamaica can seek help from. Jamaica is a member of the CARICOM. You have many countries within CARICOM who are better able than Jamaica. You understand? Me no hear nobody they say, oh, this hospital need a CT scan machine. We're asking for our members in the CARICOM to assist us in getting MTC. I'm sending the divorce papers. No divorce. No, till death do us part, Trina. Guys, it's a sad time in Jamaica. And I do hope and pray that change will come. Change will come, and I'm looking for a better Jamaica, because they say once there is life, there is hope. I hope. Oh, Trina, me no get no mango. Okay. Right, and Best Bean is saying, welcome, Trina. Right. MTC, please give Trina her mangoes. I'm hoping and I'm praying, guys, for a better Jamaica. Because once there is life, there is hope. Miss Paris, as I say before, may her soul rest in peace. May the Minister of Health and our Prime Minister look deep into the health sector, our hospitals. We are the ones to make the change, but we are locked of doing so. Now, you see, what I realize, yes, a lady here in Paris, Smith, in Falmouth, she went to Falmouth Hospital and to seek help, and they did move with urgency. They even stole her medication, and she had a stroke and she passed away. They stole her medication in the hospital and things like that. You can go back and watch the live later, but I just hope and pray that the government stop focus on petty stuff. Focus on things that will enhance and uplift the different sector, especially the health sector in Jamaica, so that persons are, as Best Bean say, if we have a better health system here, persons in the diaspora will return to Jamaica, would want to come to Jamaica. The last of the mango, I blend it with pineapple and ginger. Lord, MTC, Lord. Make me think about there's something there now. Make me want mango juice and all there's something there. So, guys, those of us here in Jamaica, open your eyes and make sure you save some money. Make sure nobody, guess what, we not plan for sick, but we know how the system stay. We not plan for sick, but make sure you have some money just in case. But guess what? Having the money and the doctors, them now do not. Just look at the lady daughter. She had the money, the family had the money, and the hospital did not move with urgency. Then drag them foot as usual. You understand? But you know, one question I want to ask, where the doctor them there? Why only one doctor run ER? Where doctor them there? Thank God for good health. Ensure you pray for good health. Yes, Trina, that is important. Thank God for good health and ensure you pray for good health. But sometimes things do happen. You know, it may not be health, it can be an accident. You understand? It can be an accident. And you go to the hospital and the same thing. I know that they're not paying the doctors them enough. So guess what you find out? Say, you know, those of them gone also somewhere else. That is so true. That is one factor. They are not paying the doctors enough. So then gone elsewhere. You understand? Respect for life is lacking in my places, or many places. Money should not come before a sacred life. Well, you have to have money to spend because CT scan at Jamaica not cheap. So it depends on the scan where you do 50,000, 25 from 25,000 go up to one CT scan. And if you have L card, it will many. Yeah, I realize it was many. I never believe in health and life insurance, but I changed my mind after seeing how so many people struggle when they lose loved one. Trina, you see, when we start work, that was the first thing I did. I took out 3 life insurance. One for my mother, one for my father, one for myself. But my one has savings and health. It has 3 things attached to it: saving, health, and life. It's very important. Money should not come before that, and that is true. You understand? You have to, in Jamaica here, every Jamaican know how it go. You better have one. If you're not rich, if you come from a poor family, make sure that you take out. Make sure you have a health card, sign up with an health insurance. Credit union have an insurance where you pay 5,000 and you can add up to 5 person on it. Yeah, I know of that one, Trina. I know of that one. That's a good one too. Yeah. But some persons don't do that, you know. But once you're working, do it, because you don't know what can happen. You don't know what can happen. You know. But it's a sad story, and as me always say, I want change. You know, and I just hope that somebody will listen to the message that the lady sent out. Miss Paris Smith daughter sent out today, and I hope someone will look into the situation at the Falmouth hospital. But you know, Falmouth hospital, you know, there is some part of it in 5,000 weekly monthly best beings. Monthly 5,000 per month. Mine is with Guardian Life, for Guardian Life, and with the health Sagicor. So me have 2. And guys, even though if you're living in Jamaica, try your best. If you have, like, I have coma abilities, so the government give free health card, like the NHF, National Health Fund. So if you have coma abilities, like me have the rheumatoid arthritis, and I have the Sagicor where the JTA Jamaica Teachers Association do. So when I'm to buy my medication, or when certain thing, I pay less. I pay less. It's good to cover yourself and family. Yes. So those of you on the live, if you don't know about NHF, if you have high blood pressure, if you have arthritis, any sickness, get the NHF. Just go to a pharmacy or to your health provider and sign up. You'll get a card, and it covers. You pay less. You pay less. You pay less money. For the surgical, when I went and did my CT scan 2 months ago, was $56,000. And a lucky thing say I have the surgical. You understand? So I pay less money. But it's good to have coverage. You know? You don't have to seek to have the card. Once you're working with a company that provides it, and if you don't use it, your husband and your children can use it. Just like when you go dentist, you pay less, but aren't they taking out a big chunk out of your salary? No. I pay how much? $500 and something come out of my salary every month for the surgical. 500 and something come out of my salary every month. For surgical. For NHF, it's free. Not come out of my pay. The government give me that. So when I combine both of them together, both surgical and NHF, so if the bill is $5,000, I may pay $1,500 or $2,000, depending. Sometimes I only pay $200. You understand? That sounds cheap. Yeah, man, it's not. Yeah. And for dental, when you work with the ministry, it's cheap. Yeah. Yeah, because I work with Ministry of Education. So that's why. So when I'm going to the dentist, I can use my card. I can go to the dentist, and then something to clean my teeth. If I have to fill, if I have to do extraction, it covers. When me I do my glasses, when I'm changing my glasses, because my glasses are very expensive, because I don't know if you know that I wear thick lenses, double lens, but you're not going to know because I scale it down. So it's thin. So that is very expensive. So I scale it down so people not say it thick. You understand? So I use my card for my glasses every year. Much cheaper than here. Yes, some things are cheaper than overseas. When my husband was in the sector, he would add me and my son, and it would be cheap. Yeah. Yeah. So that's why sometimes if I'm not well and I go to the doctor, it work out cheaper. When I go to the doctor and the doctor in charge $8,000, I just pay half of it. I just pay $4,000, and it depends sometimes where the lens are more expensive than the frame. Best beans. Yeah, eye index. So I wear eye index. Best healthcare in Jamaica is not too expensive. No, the healthcare, the insurance is not bad. I must give them credit for that. The health insurance, it's not bad. It's not bad. So, I'm at an advantage where that is concerned. So there are some good things, but the things say the hospital need to do better, and they need to get more doctors, to balance the things so that everybody can be comfortable. That sound like my son, he wears the thickest. Yeah. But if you look at mine, Trina, you're not going to see it because I let them scale it down. So when I'm changing my glasses, it has to send overseas because it cannot be done in Jamaica because Jamaica don't have the machine to scale it down. So it's thin. You understand? So me have to wait all 1 month when me I change my glasses to get it back from overseas. Yes, pricey man. Pricey. Me no like change my glasses because it drain my pocket. Drain my pocket every time. Me fi change it. And it's every 2 years. You see if you change your glasses every 2 years. Yeah, so anyway guys, thanks for your input on how equipped on the topic, how equipped are our hospitals here in Jamaica. It was a pleasure. We had to pay extra based on the thickness of the lens. Oh yeah, as I said before, mine, may I tell you the truth, every time my lens broke me, when me go, all right, you see I pay $105 for this, 105, and the lens was the most expensive. You understand? And next year, when did I get these glasses? Last year I got this glasses. So next year I have to change it. Yeah, next year I have to change the lens. But guys, from me come home from work, me not change my clothes nor nothing. Thanks for being here. Thanks for participating. You know, as I said, condolences to the family of Miss Paris Smith. Again, you know, let us hope for a change in our Jamaican health system and continue to do good, guys. Continue to stream, continue to do your video, and enjoy the rest of your evening. Yes, take care, and remember, all those who not exercise, all those who not eat right, all those who not drink water, those who are hypertensive, use this lesson with the lady to cut down on your salt intake. Take your medication if you have to. Drink up your water, exercise, and you know the steps. Blessings all. All right. See you later. Bye bye.